alaikum, my name's Nyrah, I'm a GP pharmacist and I'm your host for today's health show on British Muslim TV. Now, today's topic of discussion, we'll be talking about stress. Now, stress affects the body in so many different ways, both mentally and physically. COVID has had a big impact on a lot of our lives, and especially our mental health. And work has not only added fuel to the fire, but it's one place where you can stress over and over again. We've all been in that boat and understand how it feels. Now, to talk about stress in more detail, I've invited an amazing guest. Her name's Dr Nirja Joshi. Dr Nirja Joshi, thank you so much for coming on the show. How are you?
Thank you so much for having me. Yes, thank you for having me. Yeah, good, doing good, thank you.
It'd be nice to introduce yourself. Tell us a bit about your background, what you're currently doing.
Of course. So my name's Dr Nirja Joshi and I'm a GP based in London. I've got a couple of specialist interests, which I have specifically in mental health and wellbeing. Also volunteer for a charity called Duty to Care that helps NHS staff receive free therapy. And in my spare time, I work as a dance instructor.
Oh, brilliant. So definitely got the best of both experience in the medical world and in the dancing world. And coming towards the topic now, stress. So it can be seen as quite a broad topic in the sense that, stress can be related to mental health, it can be related to diseases. If a patient was to come to you and be like, they're stressed, how would you explain to someone, what is stress?
Of course. So stress is essentially when the body perceives a threat. So in days gone by, so looking at prehistoric times, that stress might have been trying to avoid a predator, and that would lead to a fight or flight response. Now, modern day stress is very different. So we have stress of social media, we've got stress from work pressures, working hours, modern day stresses and technology, all of these things which are having the same physiological impact on our bodies that it would have done in prehistoric times. What ends up happening is that our body is releasing hormones like adrenaline and cortisol. These things have an impact on our body and our physiology. So different things happen to our body which make it react, and that's when you start to feel stressed.
Brilliant, great explanation. And I think you mentioned, obviously hormone release, obviously that's going to display as a lot of clinical symptoms. And some people might experience symptoms and they feel as if they didn't even know that was a stress symptom. What are the sort of physical symptoms stress can kind of portray as?
So stress is incredibly varied in how it presents, which can make it quite difficult to diagnose. Sometimes you can imagine that you've had a very acute stress. So imagine if you've got to give a presentation, for example, you might notice sweaty palms, dry mouth, fast heart rate. All of these things are a feeling of acute stress. However, we know that if stress goes on for a longer period of time, it can impact on other things, so such as your appetite, your weight. Also, things like your blood pressure can go up. In chronic cases, you can have things such as gastrointestinal reflux, and also in severe cases, things like fainting, dizziness, and also heart attacks and strokes.
Definitely. And, how common is stress? I was actually looking at statistics online and they said, about 70% of UK adults last year actually was experiencing stress. Now, I know both stress and anxiety actually are overlapping. I know a lot of people came out of COVID, a lot of NHS workers as well, they came out of COVID with so much anxiety and stress from their work. But, how common are you seeing it in the GP practice that you're working at?
So I think it would be uncommon that I have a day that doesn't involve a patient with stress, anxiety or depression. And we know that this has been exacerbated by COVID. So for NHS workers, I particularly see this through my work with the charity Duty to Care. We know that there's an increased number of referrals of NHS staff who are seeking mental health support, which is great that they are seeking that support, but it also shows that the need and the demand has increased. As you can imagine, through the pandemic for everyone, it's been a change to our social liberties. So we haven't been able to go out as normal, socialise, exercise. And for NHS staff, they were carrying the additional burden of seeing excess patient deaths, but also carrying the risk of bringing COVID home to their families every day they go to work. And that was incredibly stressful for a lot of people.
Definitely, you know, that emotional burden, you know, on all of us has been so heavy and actually somewhat quite difficult to manage. I think it's had a lot of long-term consequences for a lot of nurses and doctors out there, and coming towards, you know, coping strategies. You know, what sort of tips would you give to someone that is dealing with stress at work?
So stress at work is a really interesting thing. There's lots of different facets that kind of play into stress at work. So one tip or tool that I'd just like to give you and your viewers today is thinking about what is inside of your control and what is not inside of your control. So an exercise that is useful to do with a family member or a friend is to write down a list of things that might be causing the person stress, and then try and divide them into what is inside your control and what is outside of your control. And often the things that are outside of your control are the things that are causing you undue worry, and those are the things that you might be able to let go of a little bit more. So that's just one tool that can be used to help people who are suffering.
Brilliant. And I think in part two, we'll definitely, you know, go into more detail about the different treatments out there, you know, make some good comparisons as well. And Nirja, previously you mentioned you have something like some online workshops for a lot of NHS key workers. Can you tell us a bit more about those workshops?
Yes, of course. So aside from my work as a GP, I co-founded an organisation which is called the Workwell Doctors, and we started in March 2020, so just as the pandemic was starting, and we provided healthcare support and wellbeing support to NHS staff through the pandemic and beyond. So we've worked with different people, hospital staff, practice managers, GPs, nurses, non-clinical staff who are too often forgotten, and they deal with a lot of stress and verbal abuse in GP surgeries and in hospitals. And we provide online workshops and webinars to help people with those. And now we're trying to share that information with people not in the healthcare setting. So if anyone is interested, please do get in touch.
Brilliant. Do you guys have an Instagram page or on website that people can follow?
Yes, of course. So we're at the Workwell Doctors on Instagram and www.theworkwelldoctors.com online.
Brilliant. And how often do you guys run the workshops? So if anyone's out there, they're kind of familiar with how often they actually run.
So we do them all on a demand. So it depends. If someone commissions a workshop, then we'll run it for them. So we've done it for hospital trusts before, or for practices, or for companies. It really just depends on what people want, but we'd be happy to run something for your organisation if you're interested.
Brilliant, brilliant. And one other topic I actually wanted to discuss was actually the long-term complications of stress. Because a lot of people think stress is, you know, can be sort of temporarily and, you know, it just goes away after a while. But actually chronic stress can actually cause a lot of long-term complications. Now, we might actually run overboard because our break's actually coming up, but it'd be nice if we just touched on, you know, maybe one complication that stress actually can cause in the body long-term. I think a lot of studies have actually shown it can increase the risk of cardiovascular disease. You know, is that true?
Absolutely. So we know that people who have chronic stress, so people who work in high-powered jobs, work night shifts, for example, that put the body under stress, increases the risk of cardiovascular disease such as heart attacks and strokes. So that is one certain complication of stress over the long period of time.
Brilliant. And in terms of actually diabetes, is there any studies that you've come across that stress can actually worsen, you know, blood sugar levels or any other kind of factors that might come in correspondence to, you know, raised stress levels?
Absolutely. So we know that stress is actually designed to help to release sugar into the bloodstream to help make it available for our muscles for when we need that fight or flight response. So we know that stress does impact on blood sugar levels. And for patients with diabetes or pre-diabetes, this can be especially dangerous. So it's important to make sure that those with those conditions are monitoring their blood sugar regularly. And those who might be more prone to conditions such as diabetes, if you are worried, please do get to your GP to have a blood test just to check whether that's something that you might be suffering from. Another complication from long-term stress that we know about is reduced immunity. So you might realise over a period of stress, if you might have a deadline coming up and just at the end of it, you fall ill. And that's so common because we know that our immune system and our immune response does go down with a period of stress. So it is really important to recognise that your immunity can be impacted as well.
Definitely important factors. So stress can, increase the risk of cardiovascular disease. It may exacerbate your diabetes sugar levels, if you're not careful and if it is chronic for long periods of time. And lastly, it can obviously lower your immune system. So obviously you're going to be more prone to infection. Thank you so much, Dr. Nirja, for a really insightful part one on stress. Now, if you have missed part one of the show, you can find a copy of the show on YouTube, where we'll be answering your questions. If you do have any video requests and topics you'd like to discuss, feel free to message us on our Twitter. Thank you so much for watching part two. Join us after the break, going more into treatments. Welcome back after the break. My name's Nyrah and I'm your host for today's health show on British Muslim TV. Now, before part one, we actually introduced our lovely guest, Dr. Nirja, where we talked about stress and its long-term effects on the body. Now, long-term effects on the body can include increased risk of cardiovascular disease, can help lower your immune system. Now, these two are long-term complications, and you're probably thinking right now, what treatments are there for my stress? Now, Dr. Nirja will be talking about different breathing techniques, different coping strategies, and it'll be great to reintroduce her. Hi, Dr. Nirja. Thank you so much for joining us again. I think it'll be great to actually just dive into our questions again. I did actually want to ask you, we went through the physical and the mental symptoms of stress, but when should a patient actually go to see their doctor regarding their stress? When is it that point where, hold on, the stress is getting too much, this is a red flag, and they need to seek further help?
Absolutely. So it's really important that although we know that stress is so common, and we've already outlined in part one that it will affect majority of adults at some point in their life, not everyone with stress will need to see their GP. If you ever have stress that's affecting your life, so affecting your home relationships or indeed your work, those are the times where it would be important to see your doctor for help. So for some people, for example, in the healthcare system, if we know that stress is affecting your sleep, which means that you're going into work tired and might be making bad decisions or mistakes, we wouldn't want that person to be working. So it's really important to make sure that you see your doctor so they can help you to establish whether going to work is actually going to help you to get over your stress, or whether indeed a period of time off might be what you need to help you as well. There's two things actually, Nyrah, which I wanted to touch on with regards to turning up to work when you are stressed. And we might have recognised these in our colleagues previously. So there's one thing which is called absenteeism, which is when you can imagine that you're very stressed, you're not sleeping, you're not eating properly, you realise that things aren't right, and you take a period off work for stress. And it does happen during people's lives for whatever reason. Sometimes it's acute stress, sometimes it's bereavement related, and that can play into people taking time off, and that's absenteeism. There's the converse to that, which can actually be a bit more dangerous, which is called presenteeism, which is where people do feel that stress. And these are the colleagues that you notice are turning up to work, not looking like their normal selves, not looking rested. Sometimes they can feel like they're doing not a great job or making mistakes. And those are the people that we need to be looking out for as colleagues, just to make sure that those people are getting help if they need. We know that stress, anxiety and depression all are very closely linked, and it's important to make sure that these people are seeking help.
Definitely, very important message. You can have a colleague that's got a smile on their face, or they're completely fine on the outside, but really what they really want is just to actually sit down with someone, and for someone to actually just ask, how are you today, or how are you actually feeling? Another important thing to actually include there is a lot of people actually deter away from their GPs. You know, they might get quite shy, or they might get quite embarrassed of their mental health, especially mental health in men. You know, there are a lot of men out there that think, you know, they need to be quite macho, or, you know, if they talk about their mental health, you know, the ego is going to be disturbed. But it's really important that, you know, there's that barrier that's just broken down, and people do gain that confidence to just, you know, try to book that GP appointment, or, you know, a psychologist appointment, to actually go out there and actually talk about their feelings. And now, in terms of, you know, treatments, I tried to search for a lot of coping strategies, you know, last year for the stress that I was going under. So many different things and resources online. You know, what sort of coping strategies are out there that you'd actually recommend, or the GP surgeries usually kind of recommend to a lot of patients presenting with stress?
So that's a really great question. I think it's going to depend on the type of stress that the person is going through. So if you feel like your stress is low level, or ongoing, or perhaps new and acute, you might want to try an app. So there are apps that I recommend to my patients. One is called Headspace and another is called Calm. Both do really similar functions in terms of helping with mindfulness practice, which might sound not very scientific, but actually is very much evidence-based and helps to reduce stress. And the great thing about doing things like regular mindfulness is they don't have the side effect of a tablet. So trying this is not going to harm you and will only help you without side effects. And that's why I think it's a great treatment to offer. For those who are suffering with sleep disturbance, I recommend a website which is called Sleepio, which has recently come under NHS guidance. And this also really helps to work through the stress that stops people from sleeping. So those are some places where I would encourage people to go first. And also you might be able to look up the IAPT service, which is IAPT, in your local borough, which might have a self-referral, because I appreciate there's a lot of discussion about difficulty speaking to your GP. And if you'd like to access a psychological service, that might be the easiest way to access them directly if you need to.
Yeah, definitely got a great tips, especially you know, the IAPT service that there is available to all patients under the NHS. And, you know, you mentioned, you know, tablets and side effects. You know, there was actually a lot of clinical studies proving that both CBT in combination with medication actually work best. You know, instead of actually just turning towards tablets, talking therapy and talking to people might actually lead to better results in terms of your mental health. And I think you mentioned breathing before, or breathing techniques, especially. You know, what are the different types of breathing techniques available, and what are the best ways to actually, you know, slow down your breathing and help kind of lower your heart rate, coming back towards, you know, the physical side effects of stress?
Absolutely. So we talked about the fight or flight at the beginning that is caused by stress. But the other option is rest and digest. So it's how do we get our brain out of that really fight or flight motion to try and calm it down. And you can do that by slowing down your breathing. And that helps to, as you said, Nyrah, reduce your heart rate and reduce your stress. So for our viewers at the moment, if you're with me at the moment, you're looking at a screen, I just want you to start at the bottom left corner and just breathe in for 4. And then I want you to trace across the top of that screen and hold it for 4. And then breathe out for 4 and trace across the bottom of the screen and hold it for 4. If you do that 6 times, you will help to reduce your heart rate, slow down your breathing and reduce your stress. Another technique that people tend to use is if you're in that acute moment of stress where you're feeling really out of control, you can do a double inhale, exhale. So you double inhale through your nose and then you breathe out, exhale through your mouth. So that's another thing to try if you're feeling very stressed. The best way to practice these is through doing them from the app, so Headspace and Calm that I mentioned before. And what we know is the best practiced medicine works best when you need it. So people often turn to these things when they're in that acute moment of stress, which is absolutely fine. But the more you practice it on a day-to-day basis, the easier it will be for your brain to access that pathway to help to calm yourself down when you need it.
great techniques. I've seen the first technique you mentioned quite a lot, and a lot of positive feedback with a lot of my patients that actually try that. If you're sitting down or you see like a door, anything kind of square, something that you can trace with your finger, easy techniques, but such a big impact with kind of lowering your heart rate and just making sure your state of mind is come back to normal. Because I know when you're feeling stressed, you might then get quite anxious, your mind races all over the place. So definitely important techniques. Thank you so much, Nirja, for actually sharing those. And another tip for depression, anxiety, and stress in general is actually focusing on your physical activity. Now, exercise has proven a lot of good benefits on mental health. Why is exercise so important for patients which might be going under stress?
So that's a fantastic thing to mention, and it would be wrong of us not to talk about exercise. So exercise is really helpful if we look back at right at the beginning when we were talking about what is stress, that fight or flight response. Now, if the stress that you're receiving is an email from your boss at 5 minutes past 5, then you're not being able to expend that physical energy. And what happens is that ends up building up inside, and that leads to those emotions that we end up feeling. So things leading on to things like depression, anxiety, anger. And that's what we want to try and cut that cycle. So it's important to try where possible to get some physical activity into every day. And people always ask, what's the recommended amount? How much should I be doing? Is it enough? All I would say is something is better than nothing, always. And do a physical activity that you enjoy. So there's no point, if you feel like running or weightlifting is not for you, there's no point trying to force yourself to do it, because the likelihood is that the habit is not going to stick. So for me, I mentioned at the very beginning that I work as a dance instructor outside of medicine, and I think that this is so important. So in medical school, we danced as well as studied, and actually for me that was great because it was a wonderful form of stress relief. As soon as we became doctors, the dancing disappeared, and I thought that was very odd. So I've brought it back into my life, and I now teach regular classes in person and online, and it's just so great to be able to physically relieve that stress. And we often talk about a runner's high. The difficulty about a runner's high is you need to run first before you feel the high, or if you're doing an exercise class and you get to the end, you feel good afterwards. But with dancing, the thing I love about it is you feel great from the first second. So you don't have to wait until the end, and it does give you that instant gratification of feeling great. So if your exercise or motivation to exercise is putting on a song and dancing around the kitchen today, I'll still be happy with that.
Definitely. I'd definitely like to join one of your Zumba classes soon. Thank you so much, Nirja, for such an insightful and entertaining show today. You've given us a lot of useful tips. We mentioned the long-term effects of stress, breathing techniques, the importance of exercise. We are coming towards the end of our show now. I think I've certainly learned a few things or two, about stress and the topic in general. I hope you do the show. And please follow Nirja on Instagram. She posts a lot of useful content, and again, you can visit the website Mind or the app Headspace for further help with health symptoms. Thank you so much for tuning in for today's show. Join us again next week. We're talking about diabetes and PE. Good night, office.